Hello, this is Dr. Atta from DestroySocialAnxiety.com, and today I wanted to talk a little bit about what are the success and failure factors contributing to change, because the main issue for most of the patients is to get from certain state to another state. Obviously, majority of people who suffer from social anxiety do not like that state. They want to change it and they want to move to a different situation in which they're no more not socially anxious anymore, and they're more successful in more of their endeavors. So that brings the question of what needs to happen for somebody to successfully undergo a transformation, and that applies to almost every activity. What I like to compare it to, like majority of the states of thing like social anxiety, state like social anxiety, is an addiction model. So the situation is that we have certain patterns that are developed. In terms of social anxiety, they could be, you are born with them and they are amplified by certain experiences. However, at some point they are very strong and they are quite well embedded. Similarly to addiction, when some people have predisposition for addiction, for example, if it's been fairly well documented that if your biological father has a history of alcohol dependence, you're more prone to develop alcohol dependence problem. However, just having a predisposition doesn't mean that it's actually going to happen to you. There are certain things you have to do, and that something in this case would be starting drinking alcohol. Once you start drinking alcohol and you engage in doing it repeatedly, eventually you develop alcohol dependence, and you get in a situation where it's difficult to stop. And the question is, what happens? How do you stop from certain state that you're in this case, for example, if you're an alcoholic, and how do you become sober and somebody who doesn't drink despite the risk factors that you have? And the same principle, in my view, applies to social anxiety. And that similarly, you're born with certain features, certain personality, and then they're amplified by the experiences that you've had. For example, maybe you had some bad social interactions in which you were traumatized and you don't want to repeat them, which results in you avoiding contacts or trying to organize your environment so that you don't interact with people. So it's generally, there is no script for success, but what you can identify is what makes certain people successful. Majority of people who have addiction problems have those problems all their life. There is a small percentage, and it's questionable how, what is the number. Some people say it's 5%, 10%, 20% of people who have alcohol drug problem are able to overcome it. And then there is majority who doesn't. So the question is, what does this 10% do that the rest cannot get? And in my view, from what I understood, there are two elements that apply. Number one, you have to be willing to make a change. And that is a very important concept. That has to do with the acceptance of certain discomfort. It has to do with a certain element of acceptance of your issues. And the second one is hard work. It's as simple as that. So if you want to make the change, you have to have both of the elements. You cannot just have one, in my view. If you are very courageous and you want to make a change and you're serious about it and you're not afraid of making changes and of following the directions, but you do not have regularity of commitment, you likely are not going to succeed. And similarly, even if you are the hardest working person in the world who commits and really works from the morning till night, but there is this element of lack of acceptance and lack of courage to make a change, it's also more difficult. the question is, which one of those two is worse? In my view, the hard work is more important than commitment, but it's questionable. I'm happy to accept an argument that that's not necessarily the case. I just wanted to say that from my experience in addiction, it's a very, very regular and predictable pattern of behavior. For example, when I see patients who relapse, for example, somebody who had an alcohol problem and just recently relapsed on alcohol, when I examine them, the first question I ask, or one of the first questions I ask, is, how is your recovery process going? The mainstay of recovery in alcohol is AA, Alcohol Anonymous, and if somebody was successful with it, the first question is, how is your AA going? And the answer almost always is the same, which is, I was going very frequently, typically, initially it starts with 6 times a week. And then more recently, I started to do it less frequently. I was very busy. I didn't have time, so I went 2 or 3 times a week. More recently, I even skipped the whole week. I was very, very busy. And also, the AA doesn't really work for me. That's the usual statement that the person says. That's a very, very common pattern. I'm willing to, based on majority of my experiences, it is very, very common pattern. It's rare to have somebody very committed to the program, let's say, of AA, going 6, 7 times a week and relapsing out of the blue. It can happen, but it's much more rare. The typical pattern is you go at a certain frequency, then you decrease it, suddenly it's not as important, and then you relapse. The social anxiety issue is very, very similar. People who achieve success, let's say by exposure therapy initially, if they do not commit to overcoming the issue on a regular and consistent basis, sooner or later it reverses back to the original state. And the reason is the same, in my view, as to the model of addiction. Those patterns are very hard embedded in you. And in order to counteract them, counterbalance this, you have to do the work. If you don't do the work, it's just not going to disappear. To expect that there is a treatment for, let's say, for any kind of addiction that will be once you undergo it and it's fixed, you don't have an issue with alcohol anymore, it's extremely unrealistic. The same with social anxiety treatments via exposure or via any other means. The concept of constant work is very, very important. If we assume that this is no longer an issue, that's when we get in trouble. And that's the essence of my today's video. I hope that was clear enough. And again, if you have any questions, I welcome them on the, I believe, video blog. And if anybody wants me to elaborate or some of the concepts were not clear, I would certainly welcome that. Thank you very much.